also works like this project only. If it works proper, then it is well and good. If it doesn't, then it creates all these hazards. It is a butterfly shaped gland that sits in the front of the neck. We all know it, where it is located. અને ઘણી વાર આપણે પેશન્ટ કહીએ ને કે તમને થાઇરોઇડનો પ્રોબ્લેમ છે તે ગળા ઉપર હાથ ફેરવે છે અહીંયા તમને કાંઈ નથી. So it is not always necessary that if the patient is hypothyroid, the thyroid should shrink, or if the patient is hypothyroid, then the thyroid should be big enough. It lies below the Adam's apple and it has two lobes which is connected by a bridge, or we call it a isthmus. It is a driving metabolism. ये कहेवाय ने कि metabolic force છે. जो આપણું બોડી એક ઇન્ડિયન ટીમ છે તો thyroid gland is working like Virat Kohli. Without thyroid, your team is not going to work properly. So it has effect on the brain, nervous system, sight, growth and development, protein and carbohydrate metabolism, lipid metabolism, cardiovascular, bone metabolism, muscle, fertility, pregnancy. અત્યારે સર more and more emphasis of thyroid is given in cases of the infertility and gynec and obstetric practice. So main hormones are T3, T4 and calcitonin, which are produced by the thyroid gland. And main hormone is always the thyroxine, what we call T4 or tetraiodothyronine. So we will first focus on hypothyroidism. We will only touch two aspects here, the hypothyroidism and the hyperthyroidism. Rest of the thing we will leave. Our learning objective is define, classify and explain the etiology and clinical manifestation of hypothyroid. Diagnosis and screening for the thyroid disorder. How can we diagnose clinically when the patient enters inside our clinic? And what investigation we should do in a patient. Explain the defining criteria and management of subclinical hypothyroidism. This is very important term which we will learn. What is subclinical? Discuss the treatment of overt and subclinical hypothyroidism and how it differs from each other, and describe the special condition associated with hypothyroidism, just like a pregnancy and hypothyroidism and its management. So hypothyroidism is a condition where there is a reduced production of the thyroid gland. Hypo is less and thyroidism is thyroid. So whenever the thyroid is not working properly, that condition we call hypothyroidism. It is characterized as primary and secondary. હવે primary and secondary hypothyroidism સાહેબ તમારે સમજવું હોય તો જીબીના ફોન સેન્ટરમાં ફોન લગાડો. એ તમને એમ કહેશે ઉપરથી બંધ છે. આજે ઉપરથી બંધ છે that is secondary hypothyroidism. જ્યારે તમારી પિટ્યુટરીમાં ડખા છે અને થાઇરોઇડ નોર્મલ છે then it is secondary hypothyroidism. અને ફોન સેન્ટરમાં વાંધો હોય then it is primary hypothyroidism. When the problem is in thyroid, we call it primary hypothyroidism, and when the problem is in pituitary or hypothalamus, we call it secondary hypothyroidism. It may be due to congenital or acquired defects in the pituitary or hypothalamus, and it is rare. ભૂલી જજો સાહેબ. I have seen only 10 cases of secondary hypothyroidism in this 25 years of practice. એટલે બહાર ઘોડાના ડાબલા સંભળે તો ઘોડો જ હોય, ડાયનોસોર ના હોય. કારણ કે જુરાસિક પાર્ક ભાવનગરમાં આવેલું નથી. So always think of the possible things first, then rare things. So આપણે ખાલી પ્રાઇમરી હાઇપોથાઇરોઇડિઝમ ઉપર ફોકસ કરશું. પણ નિયામેનિયા બેઠા છે તમારે ગાયનેક વિશે થોડુંક સેકન્ડરી હાઇપોથાઇરોઇડિઝમ વિશે પણ બોલીશ. So primary hypothyroidism etiology is autoimmune thyroiditis, which is called Hashimoto's thyroiditis. This Hashimoto was a Japanese doctor, and his name is given to the this thyroiditis. અને સાહેબ Hashimoto શેનાથી મરી ગયા ખ્યાલ છે? Anyone? Enteric. So it is not necessary કે જેનું નામ મળે એનાથી થવું જોઈએ. So this is Hashimoto's thyroiditis. Congenital absence or defect in the thyroid tissue. આપણે જે ભણ્યા હતા ને એમ્બ્રિયોલોજીમાં, સિન્હા સાહેબ છે અહીંયા, કે all this thyroid is produced by different dermatomes and different part, and then it progresses and then it descends. Therefore we are also having sublingual thyroid when the descent is not proper. Thyroid removal by surgery. Suppose the patient is having hypothyroidism, or patient is having some thyroid tumor, or patient is having a very big goiter for which the thyroid is removed, and then it can cause hypothyroidism. Radioablation. Suppose the patient is having hypothyroidism, and we treat the hypothyroidism by radioactive iodine, and that can also produce hypothyroidism by destructing the gland. Destruction of the thyroid tissue caused by the infiltrative disorders. હવે infiltrative disorders MBBS માં તો આપણને ખ્યાલ જ હોય કે sarcoidosis, amyloidosis, જેટલા lordosis હોય એ બધા infiltrative disorders. And impaired synthesis of the thyroid hormones because of the iodine deficiency. જો iodine ના હોય તો પછી triiodothyronine કે tetraiodothyronine થવાનું નથી. So for synthesis of the T3 and T4, iodine is essential. Congenital enzymatic defects and drug mediated, ખાસ કરીને lithium અને amiodarone. Amiodarone is used for arrhythmias in the cardiology section and lithium is used for mania in psychiatry. These two drugs are very notorious to produce hypothyroidism. Secondary, for detail માં નહીં જાઉં, but any tumor or infective disorders, mass lesion, pituitary surgery, pituitary irradiation, hemorrhagic pituitary apoplexy, ને આ જે postpartum hemorrhage માં થાય, which is called Sheehan syndrome. Why Sheehan syndrome is occurring? Postpartum hemorrhage થાય ત્યારે pituitary ને જ નુકસાન કેમ થાય? Because pituitary is most vascular structure of the body. સૌથી વધારે બ્લડ સપ્લાય pituitary ને મળે છે. એટલે the moment patient ને PPS થાય, થોડું બી શોકમાં જાય, એટલે first organ to be affected is pituitary. એટલે એનું ટોટલી એબ્રેશન થઈ જાય, pituitary કામ કરતી બંધ થઈ જાય. What we call Sheehan syndrome. આની ઉપર આપણે જશું ડિટેલમાં. And lymphocytic infiltration of the hypothalamus. So what is the spectrum of the disease? તમને એમ કહે કે ભાઈ તમારે એક જ લેબ પેરામીટર કરાવવાનું છે અને એનાથી તમારે થાઇરોઇડ ને ડાયગ્નોસિસ કરવાનું છે. Then it is TSH. If the TSH is normal, patient is normal. Now what is normal value we will see. If the TSH is elevated, the patient is hypothyroid. Just remember it is opposite. When the thyroid is working less, the TSH is high. When your corporator is not working properly, the MLA has more responsibility. When your MLA is not working properly, your prime minister has more responsibility. So because your corporator is not working, that is the thyroid gland, the higher pituitary is producing more and more TSH. So whenever there is hypothyroidism, the TSH will be high. And whenever there is hyperthyroidism, that means the thyroid hormones are produced in excess. That will give negative feedback mechanism to the pituitary. કે ભાઈ આ વધારે પડતું બની રહ્યું છે, એટલે થોડો કંટ્રોલ કરો. જેમ આપણે RBI ઇન્ફ્લેશન વધે ને નોટો છાપવાનું બંધ કરે એ રીતે. So same way, when there is too much T3 and T4 production, the negative feedback mechanism is there, which causes the TSH to go low. So euthyroid, T3, T4 are normal, TSH is normal. Hypothyroid, T3, T4 are low, or we call FT4 is low, TSH is elevated. And when there is something called subclinical hypothyroidism, what is that? When free T4 is normal, but your TSH is elevated. પહેલાના જમાનામાં હજી ઘણી ટેક્સ્ટબુકમાં એવું લખ્યું છે કે હાઈ TSH is good sign of health. ખાસ કરીને ઓલ્ડ પેશન્ટ. Yes, it is fact. Geriatric patient, if the TSH is 7, 8, that is sign of good health. But in normal patient, when the TSH is more than 4, more than 6, FT4 is normal, these patients are called subclinical hypothyroidism and they have to be treated because of some data. So TSH, if it is high, do the free T4. If it is low, then the patient is having hypothyroidism. Very clear. If TSH is high, T4, free T4 is normal, the patient is having subclinical hypothyroidism. If the TSH is normal, forget it. Patient normal છે. ઘણી વાર હોય શકે છે. Patient normal બી હોય. મોટા ભાગે આપણા ક્લિનિકમાં આવે કે પેશન્ટ નોર્મલ નથી હોતા. અને આપણે એને સ્ટેમ્પ મારવું હોય તોય નથી થતા. સાહેબ મારે B12 ઓછું છે, મારે વિટામિન D ઓછું, તમે નોર્મલ કહો છો. But there are some people, they are normal also. When the TSH is low, we do the free T4. If it is normal, there is something called subclinical hyperthyroidism. જેવી રીતે subclinical hypothyroid છે, એવી રીતે subclinical hyperthyroid બી છે. The TSH is low, but free T4 is normal. And when the TSH is low and free T4 is high, we call it hyperthyroidism. But to clear, hypothyroid TSH is high, hyperthyroid TSH is low. Free T4 karao, if it is low, then it is overt hypothyroidism. If free T4 is normal, it is subclinical hypothyroidism. So everything depends on the TSH. TSH level is more than 4. Free T4 is normal, this is subclinical. TSH is more than 4. Free T4 is also low, this is overt hypothyroidism. And if the TSH and free T4 both are normal, then the patient is normal. Patient is not patient, patient is a person. So leave him alone. So this is a clinical, typical hypothyroid phase. So our phase તમે ના detect કરી શકો, then ideally we should go back to our medical college in clinical rotation. My teacher, Dr. B.D. Mankar Sahib, who was the head of the medicine unit, એ OPD માં patient બોલતો હોય ત્યાં ક્યાંક બહાર એક thyroid બેઠો છે. The hoarseness of voice, the way patient enters inside your cabin, બરાબર, ઘણા તમે જુઓ ને અમારે એક ફર્સ્ટ યર હતો એટલો આપ્યો હતો કે એ વોર્ડમાંથી ક્લિનિકમાં અંદર આવે ને તોય એને આમ 10 મિનિટ થાય, એટલે એનું આપણે ટીએસ કરાવવું પડે, સ્લગિશ. આ ટિપિકલ કેસ. તમને ચાઇનીઝ નો હોય માણસે ચાઇનીઝ લાગે. there is loss of eyebrow. આ બધા મોનાલિસા છે. તમને ખ્યાલ છે મોનાલિસામાં they forgot to draw the eyebrow. આઈબ્રો ના હોય, બાયોલેટરલ ટોસિસ હોય અને એપ્ટિક ફેસ, એક્સપ્રેશનલેસ ફેસ. આવા લોકો નોર્મલ બી હોય એને એક્સપ્રેશન જ ના હોય, બટ ઇન હાઇપોથાઇરોઇડ whenever you see this face, this is hypothyroid. So hypothyroid, what is global